I really enjoyed running. It was the best thing for my mental health, my physical health. However, I can't do it anymore.
Pam Robertson is one of thousands of Australian women who've had their lives devastated by vaginal mesh. It was implanted to help Pam with problems resulting from childbirth, but the mesh soon turned from a solution into a major health issue.
Back pain, groin pain, infections, difficulty exercising. I had no intimate relationships with my husband for 8 years because of it. And so eventually I needed to get it removed.
In April last year, Pam went to see a specialist for a referral for an ultrasound. Instead of helping her, she says the doctor compounded her trauma.
He proceeded to do an internal examination, which was horrendous. I've had babies, I've had vaginal surgery, I've had pap smears, nothing like this. I just remember feeling that this was a violation of my body, and I said, "You need to stop." And at that point, I withdrew consent. I said, "You have to stop now."
She says the doctor didn't stop.
I had difficulty sitting for over a week. I had bleeding from the vagina.
2 weeks later, she filed a police report detailing her trauma. The detective suggested she also complain to the Health Ombudsman, and last June the Ombudsman passed her complaint to the major medical regulator, AHPRA. But its investigation didn't get far.
I contacted them, and I was told in that phone call that because I'd made a statement to the police that until the police investigation was complete, AHPRA wouldn't investigate the case. So I was a little confused because for me, I'm thinking patient safety priority.
Whilst I'm not involved in this matter, I've got some details of it from you, and in this particular case, there's no real need for them to have not investigated, and they should have investigated for public safety reasons.
David Gardner was a senior AHPRA investigator and manager until mid-last year. Tonight, he's speaking out about what he saw there.
The public's not being adequately protected. There are some practitioners out there who pose a great risk, and they're not being properly monitored or investigated quickly.
Health practitioners from 14 professional groups are regulated in Australia under a system that has public safety at its heart. So you can have confidence that every year, all registered health practitioners must meet national professional standards.
The Australian Health Practitioners Regulation Agency regulates 740,000 doctors, nurses and other health professionals. It also investigates complaints about practitioners. But David Gardner says understaffing there is risking public safety.
There were times when some investigators would have 100 files, and to put that at to give an idea of what that should be, we aimed to try and have investigators at the front end have no more than 50, and investigators doing complex investigations have no more than 30. So when they've got 100, they can't do their job.
He also says computer systems don't efficiently store or share information about complaints, with serious consequences.
When I was a manager in South Australia, we received a file transferred from New South Wales. So I opened that folder and I found years and years and years of offence complaints from New South Wales that had never been reviewed, never been actioned.
David says the folder contained around 150 complaints for statutory offences like fake doctors and backyard dentists. He was moved to New South Wales to work on the files, but says many of them were too old to be acted on.
What happened to the people who complained?
I don't know. I honestly don't know.
In response, AHPRA said that information is out of date. This month it changed the rules in New South Wales so it can now investigate complaints reported more than 6 months after an alleged offence.
If you have a concern about a doctor, if you've been harmed, or if there is a risk of harm, we won't substantively respond to that risk for months. We're too busy trying to put out fires, we're too busy trying to keep our head above water.
Toby Latcham was also an investigator with AHPRA.
When somebody makes a complaint, we give the complaint a superficial assessment, and if there is anything that we don't have, that we think we should have to make a decision, and quite frequently there is, then we will refer it to a formal investigation. And that's why things end up in a holding pattern.
Toby Latcham is now studying after suffering severe stress from his time at AHPRA. He's still on stress leave.
If you ever want to feel that life is meaningless, then spend some time at AHPRA, because we have people's lives in our hands, and in many respects we couldn't care less.
7:30 has spoken to several other former AHPRA staff who didn't want to go on record, but who all agreed overburdened investigators frequently struggle to get through their workload. We invited AHPRA for an interview, but the agency declined. Instead, it sent written answers in a statement.
We have improved our operations and increased our staffing in the last 18 months. The usual caseload for our investigators is now between 25 and 30 matters. Despite a 20.9% increase in the number of notifications received, AHPRA has reduced the time to manage a notification by 6.9%. We now routinely and quickly assess all notifications, then prioritise our management based on risk to the public.
You ready? How high?
Higher.
In Queensland, Pam Robertson has just had a letter from AHPRA after hearing nothing about her case for nearly a year.
They're only responding to a journalist who's trying to follow up issues that have been raised. It doesn't make me feel any better. It certainly doesn't give me any peace that they're doing their job.
The letter states the doctor Pam complained about surrendered his licence to practice last December. That was 5 months after Pam's complaint.
So that's quite a significant delay, and I was never informed of any of this.
7:30 contacted the doctor. He said he had no comment. With the police process now finished and no charges laid, AHPRA says it's continuing to investigate Pam's case. She thinks that's a cop-out.
My case was serious, very serious, and it wasn't investigated promptly. I wasn't kept informed, and I don't believe that they've held anybody to account over it.
But while some patients say investigations aren't thorough enough, practitioners often say the process is overwhelming.
The cost to me has been enormous. It has been all-consuming for probably the best part of 5 years now, and it still hasn't finished.
Dr Gary Fetke is an orthopaedic surgeon based in Launceston. He was investigated by AHPRA for 5 years for advising his patients to avoid sugar, defending himself for giving dietary advice as a musculoskeletal specialist.
I had to go through this enormous pathway to actually prove my innocence, and there was never a case of patient harm, never a case of patient complaint.
The watchdog found he was working outside his scope of practice.
Dr Fetke was eventually cleared and received an apology for how his case was handled. 90% of practitioners surveyed by AHPRA say they found the investigation process stressful.
Virtually everyone who goes through the process seriously considers stopping their career. I've certainly considered that, and I know of many others, and I'm talking about hundreds of people who are in the same process now.
In response, AHPRA says it's launched a video series about the complaints process.
We aren't here to punish practitioners. AHPRA exists to ensure the public is safe.
But a group of angry doctors who met last month in Canberra demanding reforms to AHPRA says videos won't cut it.
There is a genuine need for reform of AHPRA and actually taking notice of the health practitioners in Australia who tell them that there's a problem.
I was also a team leader and a manager.
David Gardner is now acting for medical professionals who are being investigated by AHPRA. He's also suing the agency, alleging it managed him out for raising too many concerns.
No matter what I tried to do at AHPRA, it didn't seem to change things. I suppose I'm now in the position where I feel like I need to speak about what I saw and speak about the problems that I saw and try and improve things, because a regulator like AHPRA is extremely important. protects the public and you need it to ensure public safety, but if it's not operating properly, it needs to be changed.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.